The Conformis process starts with a patient CT scan through the hip, through the affected knee and ankle. The proprietary IFAD software converts the two-dimensional CT data into a three-dimensional model that replicates that patient's unique anatomical bone geometry. In the 3D environment, IFAD recreates the patient's natural J-curves, corrected for deformity. From the 3D model of the patient's knee, IFAD software builds the femoral and tibial implants to match the unique size and shape of each knee, which are designed to address common causes of patient dissatisfaction, including pain and unnatural feel. That same 3D model is also used to design patient-specific instrumentation for each step of the surgery, allowing for an efficient and simplified surgical technique. Conformis has pioneered additive manufacturing and 3D printing technology for producing single-use patient-specific ijigs. Instead of reusable instruments that require cleaning and re-sterilization, ijig positioning guides come pre-sterilized and are used on only one patient. IFAD design and manufacturing technology enables mass customization, a term foreign to the orthopedic industry. Unlike any knee replacement available today, Conformis customized implants and ijig instruments are delivered pre-sterilized in a single box before surgery, greatly reducing hospital costs associated with implant storage and instrument sterilization. Simply put, IFAD technology and just-in-time delivery model put Conformis in a class of its own with unparalleled speed of innovation.